come January 1st, 2nd, you actually could start seeing some people who have purchased dental coverage that has to comport with the Affordable Care Act. You might start seeing that in your front offices. So it's a good idea to have this information now and hopefully make things a little easier for you. So I'm going to go ahead and start with my presentation is really going to be just a few highlights of it to talk about how dental fits into the Affordable Care Act and the so-called exchanges. Health insurance marketplace and health benefit exchange, marketplace and exchange, they're interchangeable terms, just so you start, recognizing that we use them somewhat interchangeably. I'm going to briefly describe what the pediatric dental benefit requirement is, and that's an Affordable Care Act term. I'm going to describe our plans, and as Mitch said, I do want to preface this with the fact that while you do need to know this information, it will be helpful, whether you're the front office staff or the dentist in the office. It's helpful to know it, but because of how the Affordable Care Act has unfolded and all of the complexities to it, we really actually don't expect Northeast Delta to be selling a lot of these exchange plans, at least in 2014. But again, this is information you're going to need to know, because if you can get one of them, you need to know it. So the Affordable Care Act actually has a lot of provisions that relate to oral health. There were some really great public policy considerations that went into the Affordable Care Act. I mean, as you see, there's funding for dental sealant programs. There's a concern about research-based dental caries disease management. So there's some really great progressive concepts about oral health in the Affordable Care Act. Now, given how expensive the rollout and the implementation of other parts of the Affordable Care Act have been, I don't know if there will be full funding for these programs, as originally was created. But at least it's in the law. Let's hope that, that there is full rollout at some point. What I'm going to focus on more today, or where Delta Dental fits into the Affordable Care Act a little more, is the last two bullets up there. One of which is that under the Affordable Care Act, obviously everybody knows that it's medical plans that are becoming available to people through this new marketplace called the exchange, or the health insurance marketplace. But what not a lot of people know is that also standalone dental plans are also permitted under the Affordable Care Act to be offered on the exchange. You in this room may know that now from Adam's presentation if you didn't know it before, but there's still a lot of people who don't recognize that they can actually get their dental coverage through the exchanges also. So that's one point where the Affordable Care Act speaks directly to standalone dental benefit plans. And then the other part is that within certain plans that are being offered in the market, the so-called essential health benefits, one of them is the pediatric dental benefit, which I'm going to go into much greater detail there. So those are the two ways that the Affordable Care Act really touches deeply on dental and dental services. So I'm going to go ahead and get into the essential health benefits now. So these are the essential health benefits. They are, as you can see them up here, the basic stuff, as Adam was saying, that a lot of this stuff is pretty much standard in Maine now in terms of what was offered in medical plans, but for a lot of other parts of the country, it wasn't standard, for example, to have, whether it's prescription drug coverage or emergency services coverage. The public policy concept behind this was that to decrease the likelihood that there will be medical plans out there that people are paying monthly premiums for and really not getting much in return for it, getting rid of those plans that, don't offer coverage when people really need it. So these are the essential health benefits. And as you see, the last one there is pediatric oral and vision services. So that relates to what I was saying before. It's great, again, great public policy that the need for good oral health was recognized, at least as to children. So it's great that that's there. On the other hand, since you're aware, most dental plans are not sold as child only. I don't know if they have been, ever before, at least in this market. So there's going to be a little bit of a divide now, because since the essential health benefits and the rules that go along with it only apply to kid coverage, now you're going to see in family plans there will be coverage that applies to the kids with certain standards, and then coverage that apply to the adults who are in the family plan with different standards and different benefit levels. So we'll go into that in a minute. Let's go ahead and get started on what they actually have, who this applies to. So the essential health benefits do not apply to every single medical plan that's being sold starting in 2014. There are actually large groups that it doesn't apply to. The essential health benefits only apply to plans that are either being offered in the individual coverage market or the small group market. And small group is currently being defined as fewer than 50 full-time equivalent employees, right? So whether those plans are being sold on the new marketplaces or whether they're being sold in the private market, outside of these new marketplaces, regardless, in theory, they're supposed to cover the essential health benefits for individual and small group markets. So when you think about, who comes into your offices, recognize that there are large groups then that this does not apply to. Large groups, this does not apply to. Anybody, a large employer who's got more than 50, right? Self-insured, groups that have self-insured medical plans, the whole essential health benefit doesn't apply to them. The few folks who still have so-called grandfathered plans, as Adam described, plans that were in existence back in a certain date in 2010 that haven't changed significantly enough to have lost their grandfather status. Obviously, the benefit for some people of having a grandfathered plan is they do not need to comply with all these additional requirements that kicked in for 2014. Some kicked in a little earlier. So you can see how there are whole groups out there, whole categories of people that do not have to have the pediatric dental benefit, right? They can continue to offer dental benefits that are more traditional plans. They're not required to have this fairly, restricted is not the right word, this fairly prescribed pediatric dental benefit, right? So you begin to get the sense of when we talk about we don't expect to see a lot of our exchange plans sold, this is part of why that is, because there just aren't a lot of people who have to buy these special pediatric dental benefit plan, because there are many people who don't, the essential health benefits doesn't apply to what they've got to offer their employees. And then also, and this was one of the Affordable Care Act has yet to sit long enough for the dust to settle on it. So, you probably have heard most recently the regulation that came out, or the ruling that came out from the Obama's administration, was that people who had plans that were in existence, medical plans that were in existence as of October 1 of this past year, 2 months ago or so, right? If you had a medical plan that was in existence as of October 1, you are being allowed, as long as the carrier is agreeing to it, you're being allowed to renew that medical plan for an additional year, which again puts off the additional requirements that come under the Affordable Care Act that ordinarily would have kicked in for January 1. So, in other words, it's another category of people who, if they opt to renew the plan that they had for October 1, instead of waiting for that plan to terminate at its normal termination time, they're basically buying more time of keeping that existing plan and avoiding the ACA requirements, one of which is the essential health benefits, one of which is the pediatric dental benefit, right? So you can see how it further kind of chips away at how many people would need to have this pediatric dental benefit, right? Okay, so going farther. So how is that pediatric dental benefit being made available to people, for those people who need to have it? Well, it can either be, you can find it one of two ways. Under the Affordable Care Act, that pediatric dental benefit, and I will describe what it actually looks like shortly, that pediatric dental benefit can either be embedded in a medical plan. That's the route that Anthem is taking at this point. They're going to be, they're actually attaching a standalone dental plan to their medical plan, but you can either have the dental benefit embedded in your medical plan, so it's a service that's covered the same way a mammogram or other services might be, or you can purchase it through a standalone dental benefit plan, which is where Delta Dental comes in. So in Maine, in the Maine market, on the marketplace here in Maine, Anthem is providing a medical plan, and they also have standalone dental that they're offering to people. Maine Community Health Options is not providing the dental benefit, and that the other point, the second bullet up here, is that's as a result of another provision of the Affordable Care Act, which says that even though the law starts off by saying that all medical carriers, again, who are offering plans in the individual or small group market, must include all 10 essential health benefits in their plans, another provision of the Affordable Care Act says, as Anna was explaining earlier, that if there is a standalone dental benefit plan already being offered on the exchange or being offered on the exchange, then that saves the medical carrier from having to also offer that 10th essential health benefit, the pediatric dental benefit. It's what's called, referred to as the dental carve-out. So those are the 9 out of 10 essential health benefit plans. So that's what Maine Community Health Options is offering. And so in theory, that you can buy your medical plan through them and then combine it with a Delta Dental medical plan, dental plan. And the combination of the two would have satisfied whatever essential health benefit requirement that applies to you. So that's how those two work. Now, as I was saying before, the pediatric dental benefit, besides there being whole groups of people that it doesn't apply to, shortly after the Affordable Care Act was passed, further regulations the regulations that kind of put the meat on the bones of the Affordable Care Act to explain to us what it really means, regulations started coming out that further chipped away at who actually has to have the pediatric dental benefit. Some of them make sense. For example, if you're an adult, you're not a pediatric, or you're not a kid, right? You do not need to purchase the pediatric dental benefit. You will have satisfied any requirements there are that apply to you if you buy a medical plan that doesn't have the pediatric dental benefit without having to then buy the additional pediatric coverage. So that one made sense. That was, one of the first regulations that, again, started to kind of chip away a little bit at who had to get the pediatric dental benefit. Then another regulation came out and said, well, if you buy, no matter who you are, if you buy one of those 9 out of 10 medical plans, then since that's a qualified health plan, even if you have a kid, you don't need to buy the pediatric dental benefit separately too. So it was another chink in the armor of the whole thing, and so on. So that's why, jokingly around the office, we kind of refer to the pediatric dental benefit as the only non-essential essential health benefit. And again, so the effect of it is that it's reducing the number of kids who would get their dental coverage through this rather prescribed benefit. And least it be confusing, certainly my message today is not, therefore, don't get it. Don't get coverage for your kid. It's just letting people know that the other options that are available remain available. If you don't have to get the pediatric dental benefit, the more traditional dental benefit may be preferable anyway. For one reason, it's a way to keep the whole family together in a family plan, as opposed to the kids being off on their own distinct dental plan, right? And then the family plan being separate to cover adult kids and the adults. It keeps it as one family unit in a plan. Okay, so let's get into, so who and what and who does the Maine pediatric dental benefit cover? So I assume at this point you're wondering, well, what are the covered services of this? And if anybody here is familiar with what the federal employee dental and vision insurance plans look like, or if you've seen or you're familiar with the details, that's what all of the pediatric dental benefit plans here in Maine are based on. That was the plan that was selected at the federal level that all of the dental plans that satisfy the pediatric dental have to mirror in order to satisfy the Affordable Care Act's requirements. So when we first learned through regulation that that's what the plans, that was one of the plan options, we went through code by code, CDT code by code, and I think you would probably agree with us if you looked at it that it's a fairly comprehensive plan. It is as much as a typical employer's plan would be. In fact, it might even be a little more robust, a little richer than what the employer plan looks like. So we found when we were making a recommendation to the state on this that we found that it would have been purely as much as the other options that were available acceptable as a dental plan that you would want to have offered.